Ma'am, the attendees are joining. We will begin in next 1 minute time.
Sure. So this webinar is live streaming on YouTube. That's what the message says.
Yes, currently it is. Absolutely.
So if I want, I can also see it on YouTube.
So, ma'am, let us begin the evening. Still the attendees are joining. So, extremely happy to have you, ma'am, today. So, good evening all the attendees today. And my name is Diptiman Tripathi. I'm the Managing Director for WEFA in India. As we all know, we have been discussing about the great initiative which I'm the Best Mom is taking. And motherhood is an enriching journey of undaunted greed. Every day mom puts in her best to nourish and raise her children in the best possible way. But motherhood too comes with its own set of whims and challenges. And in this overpowering journey of a mother, a mom has many questions, but not enough answer. And I'm the Best Mom is a platform where we try to answer some of your queries, be it related to children or mom. So today we have another beautiful session is yet to begin. And attention to communication. Now, today, when we see a newborn, or be it adult, every moment we see the child or the adolescent time, or even when we grown up, we are interacting. Now, when we are talking about children, and what it depends, like what kind of emotion carries, like whatever we are communicating with our children. Now, today, children can understand the language before they come to the earth. Now, today we are going to have a beautiful session with Dr. Naik, and Dr. Neeta Naik comes with almost 3 decades of experience with, she is a consultant child neurologist and developmental pediatrician. Ma'am comes with a huge amount of experience when it comes to children, and particularly children with special need. So she's consulting child neurologist, and she's the director in charge of a comprehensive and a dedicated child neurology center, EN1, Neuroscience Center in Mumbai. She's also visiting consultant in the child neurology to Department of Pediatrics at BLY Nair Hospital and multiple other hospitals in Mumbai and Goa. She has a lot of articles published and major domain of work is with epilepsy and neurodevelopmental disorders. So ma'am, it's a great pleasure to have you today. And attention to communication is definitely a very interesting topic for all of us, be it at any age of our life. So ma'am, over to you. And I would request all the participants to put up their questions on the Q&A section, which we will be taking it towards the end of the presentation.
Yeah, so good evening, everybody, and I'm happy to be invited for this talk on attention to communication. I thank I'm the Best Mom team for the same, and I think without losing much time, I think I can start the presentation.
Certainly, ma'am.
So we are going to talk about attention to communication. I know you had a lot of series on various parts of child development, emotions, and maybe learning. This is about communication, and obviously there is a lot of possibility of a lot of overlap between what I talk and what you heard before, and this you can take it as reinforcement of understanding how to do parenting. So the first part I'm going to talk about communication. So when we say communication, what do we mean by communication? The communication, it comes from the word Latin word communicare, which means to share, or it's an act of conveying meaning from one entity or one group. One entity means one individual, we can say over here, and one group to another through the use of mutually understood signs, symbols, and semiotic rules. So basically, it's about sharing of a thought or sharing of an idea or sharing of an emotion. That is essentially what communication is. So though we many a times look at communication as only, as probably a language or only speech, but actually communication is much more than that. So when you're talking of communication, initially there is formation of communicative motive or reason. Means initially there has to be a thought, something has to come in your mind that you want to say. So that is the motivation or reason for communication. Then what happens is after that there is a message composition. So my brain will say, okay, I want to convey this thought or this emotion, and therefore this is the way I will compose, though it is not so obvious, and it's to a large extent at a subconscious level. You're not aware that your brain is working. Then what happens is the message gets coded in the language that you speak. So if I speak in Marathi or Hindi or English or whichever other language, the message that I want to convey will get encoded by my brain again based on what is my training in the language. Then the message gets transmitted. So I speak. So what is the tool for transmission? Could be either my language, oral spoken language, or it may be written language, or it may be a sign language, or it could be just an expression. But then once I encode the message in my brain, I will convey it. Then there is reception of signal and reassembling of the encoded message from the sequence of received signal. So the other party, the other person will receive the signal, and then he will decode or reassemble them, and finally he will decode a decoding of the reassembled encoded message. So it's such a long drawn process when you're talking of communication, but it probably happens very very quickly and at a subconscious level. So this is just a image to show the same. So when you're talking of communication, so this was what I said earlier, was like how what exactly communication means and what happens in the brain when communication happens. So when we are talking of communication, the first thing that happens between a baby and a child is what is known as a non-verbal communication. So every time for communication, language is not necessary. uh, so non-verbal communication is what happens through expression, through eyes, and it's a communication of emotions essentially. And when you communicate emotion, you also probably communicate a lot of what you want to say. So non-verbal communication, it explains the processes of conveying a type of information in the form of non-linguistic representation. So once you build a relationship, it can be a relationship between a mother, a child, or two friends, or it can be father and son, and it can be a young child or old child, or it can be husband and wife. There's a very nice sentence. It says you cannot not communicate. So you are always communicating to your family members. You're not speaking, but you are communicating. So non-verbal communication is omnipresent. It's like air, it's always there. So when we are, whether we are talking or whether we are not talking, we are always communicating with people who are close to us. And it is even when you are communicating, when I'm talking to you, I mean actually using language and communicating, I am also doing, along with that, I'm doing a lot of non-verbal communication. So it is multi-fact functional. Many different non-verbal channels are engaged at the same time to communicate. So it is my expression, it is my eyes, etc. So non-verbal communication forms a universal language system. You don't need language for non-verbal communication. A baby is all the time, you can see in the picture, baby and mother are communicating happily with each other. The baby is conveying his happiness to the mother, and the mother in turn is responding. So smiling, crying, pointing, caressing, and glaring are all non-verbal communication, and in that you don't need language. And non-verbal communication will go on throughout your life. Now what is verbal communication? So verbal communication is the further, a child in the first year of life in the probably first 6 or 7 months of life is already non-verbally communicating with the family, and it's only after 7 to 8 months after his baba dada becomes words he starts verbal communication. So verbal communication is a spoken or written conveyance of a message, and language learning normally occurs most intensely during childhood. So it is sounds or gestures. That's how verbal communication happens. Now, family communication. What is important in a family communication is to a good family communication is to understand the interaction of the family and a pattern of behavior of family members in different circumstances. I mean, this is actually not appropriate sentence. The second sentence is important. Open and honest communication creates an atmosphere that allows family members to express their differences as well as admiration. It's very important that the family communicates again by non-verbal means, verbal means. But when the children become older, more than 2 year old or 3 year old, obviously the verbal communication takes precedence over non-verbal. And as a parent, your role is to encourage the communication the child, not only give instructions. Many a times we forget to give enough time and space to the child so that he communicates his thoughts. So for actually in the communication between parent and child, it is important that the child is encouraged to communicate. You need to communicate for maybe 20 to 30% of the time, because many a times it is just instruction and repetitive instruction. But allowing the child to communicate his thoughts, his emotion, and allowing that atmosphere where he wants to communicate with you is extremely important, because it will build the block for your entire relationship for rest of your life. So obviously communicating with babies is the foundation of attachment. And once the baby communicates, the baby will start communicating non-verbally before the age of 7 months. Then the child will go on speaking words, form words, and then make sentences, and then learn to say read paragraphs, or speak longer sentences, and then say actually communicate with paragraphs or whatever, more language. So what happens is, one of the things that we see nowadays is that uh, children, a lot of children who come to us as patients, frankly. I mean, I don't know whether this crowd has just mothers or normal children, but I think this is something fact that all parents should know, that a lot of passive learning is happening today in the society, because of so much of excess of digital presence. So every family will have more than one digital device, so it can be either a phone or an ipad or television or whatever it may be. And therefore a lot of young children, very very young children, even infants sometimes, and even 1 or 2 year old children, tend to spend a lot of time with passive learning. But passive learning is a very one way kind of activity, where the child does, there is no motivation for communication. In a child, it is most important that he is motivated to communicate. There has to be a desire, because if there is no motivation for communication, then the child is not going to speak. And in the first 3 to 4 years of life, you can call their golden years for communication and language development, because the brain is extremely plastic, and maximum uh, de- language develops in the first 4 years of life. So it's very important that you encourage communication by speaking to the child and ensuring that he speaks back or non-verbally communicates with you, and you spend a lot of time interaction. So interaction, engagement forms sort of cornerstone of good communication with the child. There has to be interaction. It can't be passively the child is watching something TV, and then he repeats the nursery rhyme, and then he says ABCD, and he says 1 2 3 4. It's of no use. So
Right.
parenting is not all about communication, but communication is a very important aspect of parenting. So of course, two-way communication, as I said, is very essential to build your child's self-esteem. Actually, it's not only self-esteem is a very far-fetched word, and a desire, or as I said, motivation to communicate is very important, because When we get these children who are watching a lot of TV because of whatever reason, you can't blame the parent, but parent may be busy in something or whatever it may be, but the child completely has no clue that there is something known as communication. The child is so self-absorbed, and many of these children do behave or become like autistic children. So you have to really then understand whether these children are behaving like that because of excessive screen use and very very minimum stimulation in the form of communication, or they are actually truly genetically autistic disorder. So what is important is, you have to understand that this is golden period. I mean, you cannot neglect or ignore or reduce the time that you spend for a in a child who is very young. So first 4 to 6 years of life are extremely important for child's development. Communication is fundamental to children's development, and children need to be able to understand and to be understood. And if there's no motivation to, speak in a child, then child is very self-absorbed. He plays by himself with toys, and he may have preferential interest in toys. I mean, we don't want that. Communication is the foundation of relationship. Obviously, in future, when you grow up, you know that communication, whether verbal, non-verbal, written, whatever it may be, but it is the foundation of relationship and is essential for learning, play, and social interaction. So, certain principles for producing communication for children is, communication obviously has to be age appropriate and child friendly. I'll give you examples of what do we mean by age appropriate. Communication for children should address the child holistically. It should be positive. This is very important, that it should not be negative for the child, either pointing towards his negative behavior more often than positive behavior. And so it rather be positive and strength based. And it should address the need of all, including those who are disadvantaged. So let's see now when a child develops. So when a child early years. So these are the characteristics of a child from birth to 6 years. So child is developing in various domains. You call it domains. So he is developing, and we are not talking about motor domains. Yeah? We are going to talk about only cognitive, behavioral. Cognitive means intellectual, behavioral domains, social and emotional domains, and communication needs. So what are for his early years, that is birth through 6 years, what is it that developing in him? There's an early experience of everything: shapes, colors, people, animals, sound. There's concentration on concrete aspect of reality. There's developing of awareness and sensitivity to gender differences. There's difficulty in understanding codes and conventions and growing aware. This is okay. Behavior. So behaviors, what is important is learning by doing and playing, repetition and routine. He's developing motor skills. He's learning to express as well as control emotions. And in social emotion, he may be experiencing new emotions. He's developing slight amount of autonomy. There is an evolving awareness of their own and other emotions. He is learning to play with others, learning to resolve simple conflicts, and he can show empathy also. And what are his communication needs? That to know that they are loved and they are safe. This is very important. To develop positive feeling about themselves and others. So positivity is important, love is important. To know that the range of emotions and fears they have are normal, and to develop resilience by learning to bounce back. So what is the implication? Now you know what develops. So what is it going to, how you are going to make your communication? So as I said, use loving tones and simple language. Don't make it very complicated. Growing up, raising a child, don't make it complicated. It has to be a joy. Be playful. As I said, so there are the learning has to be through play, and it has to be fun. Use pretend, open-ended and imaginative play. Use a lot of repetition. He's a child, so he needs repetition, rhymes, and songs. Involve question and answer interaction, and encourage him to talk. And use everyday experience, simple stories, children's, family, animals, and typical daily activities and routines. So keep it simple, keep it loving, keep it happy, if you ask me, because the child is still very young, and it is his emotional experience that is going to dominate the learning. It is not what you teach. ABCD 1 2 3 4 spelling and all that. So so what happens to this child now when he becomes 7 to 10 years old? So once he becomes 7 to 10 years old, there is a better understanding between fantasy and reality. There is understanding of inner motivation of characters, understanding of causality. Why the why they start understanding the why of things. They use better sophisticated language. They develop the ability to understand television and other media codes and convention better. The behavior becomes gradually more independent. They can take care of their daily needs, learn to follow rules. They become more interested in drama, sports, etc., more concerned about body image, and they take more responsibility of their own action. Socially, they develop friends. They continue to need supportive adults, but they are still young. So, but they prefer same sex friends. They learn about right and wrong, making moral choices. So communication needs are what? To nurture positive feelings about themselves, others, and larger words. Again, nurture positive feelings. To explore and test their own ideas, skills, and talents. To be guided by using their own potential in a positive way, and to have their feelings and worries understood and respect their feelings, respect their worries, talk about them, discuss with them. So what are the implications of this development? So you may have to, when you are trying to you discuss things with them, because now they have become older, little older, and they understand ideas. So you will have to present longer and more dramatic stories, that they can be child centered stories and idea. Portray learning and school achievement as an opportunity to develop new interesting skills and talents. Use strategies such as visual and auditory humor. Add humor, give them cognitive challenge. There have to be include interactive problem solving, critical thinking. Pro-social actions are important: kindness, conflict resolution, caring, etc. Also, value-based education is important. Present stories about friendship, loyalty, doing the right thing, etc. Um, Okay, fine. So, and then they become older. So here they become now 11 to 14-year old. So when they become 11 to 14-year old, they are capable of adult like abstract and logical thoughts. They have emerging concerns and exploration of options regarding, they want to know what is their future plan going to be. Literacy level may not be consistent with chronological age, but that's fine. They are increasingly independent, and they don't want adult authority, as they don't accept it so much easily. They're interested in mastering physical challenge. They experiment with behavior, and sometimes they may experiment with risky behavior. And nowadays that age is coming younger and younger, where children are maturing faster and faster because of the exposure to media. And they experiment with identity behaviors, etc. So what are the communication needs here? To be informed and guided into adult life, including about behaviors that put them at risk, and about responsible sexual behavior. To have strong and positive role models with high standard. To have recognition and respect for their opinions, and to allow to learn from mistakes and correct self-destructive behavior. So all in all, in summary, what is important is talk respectfully, not didactically. Present positive peer group behaviors. Portray character with high self-esteem. Present high interest, low literacy. Forget this. Use a lot of humor, creativity, and present challenging stories and creative ideas. So that's okay, fine, not very important. Again, use a lot of positive phrases. It's not that you keep on positive, falsely use positive reinforcement, but always do more positive reinforcement than negative reinforcement, because you know the Pavlov's law. So positive behavior, the behaviors which are reinforced repeat, that is a basic, one of the basic science of human behavior. So even if you're giving attention to negative behavior, attention is in itself a reward. So the more attention you give to negative behavior, the more it's going to repeat, and the more attention you give to positive behavior, the more it's going to repeat. So always give attention, because attention being a reward, whatever behavior you want the child to reinforce, uh, pay attention to that. So it's always good to pay attention to positive behavior, because child usually forgets the negative behavior, or he may stop doing it because if he doesn't get any reward, there is no reason for him to repeat it many a times. It is only because you're getting he's getting reward through attention that many a times a child repeats his negative behavior. So all these phrases you can use and praise him and all that. So this I think we will skip because I'm going to come to that little later. So things to remember is positive communication with children means paying attention, respecting his feeling, watching your tone of voice. Even if you have busy schedule, you have to allocate time every day. Listen to it. There's something known as active listening. There's a skill known as active listening. So active listening means listen to the child when he's speaking, listen, understand him, understand his emotions, and react accordingly or respond accordingly. Sorry, I did my presentation. So I don't know whether I should continue or I should stop over here. Can anyone tell
Um,
me? Because
Ma'am,
I have slides about speech and language. So we finished actually communication as such, and the next part
so
is
what
about
can
speech
be
and
done?
language, which is not.
Yes,
Sorry.
ma'am. What we I may request the attendees if they have some question, because you have narrated starting from zero age to the adolescent time, and when we are communicating with our children, be it passive learning or be it when we are involving our emotions and all, let the attendees post their question on the Q&A section. uh,
There are some questions which are on the chat box,
yeah,
Q&A. So one is, I am not sure whether I'm supposed to answer. Okay, without taking the name, maybe it's a private question.
right.
But yeah, I think I can answer without saying. So there is someone who has asked about how there's some deformity in the leg and her weight is 8.5 kg. But really speaking, I cannot answer that question ever. I mean, at all without seeing the child. I mean, bow legs. I don't know.
Sure.
I cannot answer that question. And another question is, my daughter is 3 year old complete, but her behavior is not like a 3 year old. So I don't know what you mean by that question, because every child develops differently. Yeah, some children may, the maturity level and the developmental domains, every child may develop differently, and many a times that is a genetically defined thing how your child is going to develop. So you might be knowing that every child develops in 7 to 8 domains, that is a gross motor domain, fine motor domain, language, social behavior, communication, cognition. These are the and in language there is expressive language and there is receptive language. Then there's social behavior. Cognition means thinking and emotion. So these are the main developmental domains. So many a times children may develop, all the children may develop, I mean the children may develop all in all domains uniformly. Means a child may develop uh, like a 2 year old is just like a 2 year old in all domains, or some children may be that they are falling behind in one or two domains, but some children may fall behind in all the domains, and they may catch up at a later date. But at any given point of time, there are two things that you need to do. That is there progress, is the child making progress, or the child is regressing, or the child is starting, is your child developing? Because a 3 year old should be developing fairly rapidly, or 0 to 3 years is a very rapid developmental time. So you should look at the rate at which the child is developing. As in, I mean, you might be the first time mom, so you may not know the rate, but at least if you read little bit about it, you know by 3 years what is it that she should have achieved. And if you don't know also, it's okay, you can go to pediatrician and express your concerns that okay, she has not developed in this area or this area. Now any development which is lagging behind, whether it's just because of environmental influences, a lack of stimulation, lack of motivation, or some genetic inherited factor where some children develop late, or it is something on which you have to act, has to be decided very often by the doctor. So if she's
I think,
not
ma'am,
developing, it's a very general term, and there are assessments available. Is your child developed like a 1 year old or 2 year old or 3 year old? there are assessments available. So if it's a cause of significant concern, and therefore this play school, nursery and all that are useful, because then you can compare with other children of the same age, and you know, okay, oh, this child is already speaking majority. I'm not saying compare as in compare. Again, nowadays parents say I'm not comparing, but you have to compare to know whether they are age appropriate. I'm not saying you compare achievement, you compare just simple age appropriateness.
True, ma'am. One interesting line when you said when the children are into the age group of say 7 to 10 years, they start coming up with a lot of question with why.
Yeah.
So a lot of inquisitiveness to understand why they have been stopped, why they are not been allowed to watch freely as they used to watch probably in the early. I'm talking about the digital world. So that there is something like a kind of a radar we have brought. A lot of restriction probably they see, and
Yeah.
the moment we stop them, they would love to or they try to do achieve that as their success. So
Hmm.
then there is a tussle happen with the parents and the child who are not even teen, but they are gradually probably getting into that.
Hmm.
So when it comes to girl child, probably and boy, there are different set of experience we are also seeing. Many times the boys are little aggressive, maybe with their physical activity, or maybe when they're a little louder, or maybe. So does gender play a equally important role when we are talking about communication? And does this assessment, one is like as one of the attendees has also put up a question about the milestone which you covered, like 3 years still not verbal, or uh, does it matter, or we should be careful about the gender or not?
Yeah, gender means it is possible that sometimes boys may talk late, but really speaking, if you're asking me whether may have an effect on the personality, but not necessarily the development of language and speech.
Yes.
uh, what affects the speech and language development is very many times the genetic pattern, because many a times they say no, no, the father also spoke at 3, father spoke at 4, mother says mother spoke at 3, but she understood everything before that, but she spoke at 3. So if there is a very strong family history where the parents have spoken late, because it also depends on personality, there are, every family is different. There are families where hardly people hardly speak with each other, but there's nothing pathological about it, dysfunction. The family is not dysfunctional, but they speak less. There are families who speak less, and there are families who speak more, and there are parents who speak late, and there are parents who speak early. So when we take history, we have to find out when did the parents speak, and what are the grandparents saying about their parents early childhood development. Did they speak on time? Did they speak late? Did they understand? When did they have developed their receptive speech, expressive speech, etc.? So that is point number, so that is extremely important. Rather than gender, I would say it is the family history which affects when a child is going to. But there is a question where someone has said, at 3 years, my child is not talking.
Yes.
So that is definitely a cause of concern, unless there's a very strong family history that everyone spoke late. If a 3-year-old is not talking, one is when a child does not speak at 3 years, you have to see whether the child hears. Is it expressive delay, receptive delay, or delay of both expression and reception? Expression means child cannot speak, but maybe the child non-verbally does communicates, but her speech has not, her or his, whatever, her speech has not developed. But how is the receptive speech? Because receptive speech is a must. Receptive speech means whatever you tell the child reacts to it. If the child cannot say yellow, but if you say where is yellow, show me, the child should be able to show. But and if not, you have not taught colors. Then if you say stand up, sit down, go to that room, bring this, whatever, at least a 3 word command a 3-year old should be able to do. So in a child who's a 3-year-old child who has not yet spoken, there could be like variety of diagnosis. It could be a hearing impaired child. The child cannot hear or cannot hear in all the frequencies. Sometimes the child hears in the higher frequency but does not hear in the lower frequency. That child could have a speech delay. A child may have receptive language as well as expressive language delay. So he she neither understands nor can speak, and when that is there, if she has, then it could be what is known as a developmental dyspraxia, or it may be autism also. But autism, there are other red flags. And if the child is very good in reception, she understands everything, she follows every command, but she doesn't speak yet, then it is just isolated speech delay. But for everything, you have to definitely go to a developmental pediatrician or a therapist and find out and investigate accordingly. Sometimes children who have lower intellectual or social quotient, developmental quotient, speak very late. So there are various common reasons, around 4 to 5 common reasons, and we have to rule out, and we have to start early, because as I said, it's golden period, brain is plastic, you have to teach early. If the child is not doing something, you have to help the child to do it.
Thanks, ma'am.
Okay.
One more question. Let's say in India, most of the children speak they're multilingual. They speak the original language, English, Hindi. And if we compare the children from the Western countries where probably the limitation are there, they speak either English, Spanish, or maybe some other language. Uh,
Yeah.
how it helps to their cognitive skills, or maybe does it help them to learn more, or how it affects as an overall person when they grow up?
I don't think it. Yeah. No, I don't think it affects negatively at all.
No, how positively
There
it
are so
affects?
many households where three languages are spoken.
Yes.
Oh, positively. I'm sure it positively affects, because we all in India know three languages at least. We all know mother tongue, we all know English, and we all know Hindi. So, I mean, I don't know, like how it's difficult to answer this question, because I will have to do a age match control with a group of 100 children who are exposed only to one language and who are exposed to three languages, and then see who develops better positively. But I really think that comparison is very difficult to do, because it is very socio-cultural thing. I would say, but there are parents who ask me that no, no, we spoke three languages. This one, mother speaks Tamil, father speaks something English, servant speaks Hindi. So I think she is not speaking because she is confused and exposed to three languages, which I think is totally wrong, because child is capable of learning everything. Child will may not speak very, may use words from different languages, but that's not going to definitely delay the development of speech or language. That is in fact going to enhance, if at all. It will definitely not delay. Yeah, but if the child is a special child, say for example autistic child, in which the biggest challenge is speech and language development, that child I would recommend, or we recommend, that you expose the child to preferably one language, because for him it's a challenge. So don't give him another three languages to, because it's already a challenge. But in a normal child, I would say no harm exposing the child to three languages. But I won't know, because we don't have age match control to children grown up in US who are exposed only to English versus our Indian children who are exposed to three language. I would not know whether it affects the intellect
Okay.
of the, that question I cannot answer.
And ma'am, the children who are like graduated from the NICU or maybe preterm birth who have, uh,
Yeah.
what kind of conscious effort the parent should take when the child is at their very early age of life?
So yeah, a child who's an NICU graduate, the first and most important thing is that the child needs to be screened for everything. The child has to be screened for hearing. The child has to be screened for visual defects. The child has to be monitored very closely for the development, because the child is developmentally delayed, or the child has any motor difficulty, child has language, visual difficulty. One disability has a lot of strong effect, and many a times NICU graduates may have more than one disability. So someone may have hearing plus vision, some may have vision plus say motor difficulty. So these children needs very very early intervention, and if you do early intervention, because the child's brain is plastic and capable of learning, if brain is also damaged in a particular area, also the brain cells or neurons which are surrounding area are capable of learning.
Right.
Even visual learning happens. The child whose visual cortex is damaged, in those children also visual learning happens with the surrounding brain area. So you should not give up the what you call the time period or the possibility of teaching the child, even if there is any underlying brain damage. And there is one question I think I should answer that, which is there on that chat, which says, is lockdown affecting child communication development? Yeah, I'm sure the child who used to meet, 50 children every day, Subesham, going to by bus, going to school, talking to all the colleagues, talking to the teacher asking questions, that entire experience is gone out of his life. But I'm sure it's not a permanent thing, and the child can come overcome. The whole world is I mean, the lockdown is a new experience for the whole world, so everyone, something is affected, something is not affected. It is a family. At the end of the day, every child has their family. Okay, so family has to make little effort and not uh, now earlier he had school and teachers, now they have mother and father, no, because mother and father are sitting at home because of lockdown, so
Correct.
spend more time talking to him, etc., etc. So I think it's okay. I mean, the challenge, but it's not like the challenge for the child is the lowest. It's challenge for the family. It's much bigger challenge we are all facing as human race. The communication is one of our smallest challenge. Lockdown communication is the smallest challenge, I think.
Well, Billy, what probably people, maybe children learn a lot by seeing. Sometime
Yeah,
non-verbal communication plays a very important role in their life.
yeah,
So everybody is adult, children more, or everybody is at home. Different set of communication happens. So
correct.
sure, as a family, everybody's
So basically, what you have to do is ensure that, I mean, I know it's difficult, but like for example, I would say that in this lockdown period, it's very important that you stay happy, be optimistic, because your emotions also you're communicating constantly to the child, and if he's there and you are not happy, whatever some difficulty may be there in your family, whatever it may be, but you have to be hopeful, positive, and not allow that emotion to go to the child or make him the target of your negativity. That is more important than anything else, is what I would probably say. And someone has asked a question. I saw some question over here. Does prenatal communication affect brain development? I have no idea. I don't know, but in our Puranas and Vedas, they've said that the mother should, say shlokas and all that. But in our allopathic science, तो हमें मालूम नहीं है सब. But no harm. Prenatal communication. Say some, prayers. Say something good. It's not going to. Anyway, there is a lot of, see, in our culture. It's very important that the mother, when she's pregnant, is kept happy, is well looked after, and she's fed well, and she says good things, she sees good pictures, she says all prayers, good prayers. I'm sure that has an effect, but I don't have a scientific reference. I never studied that.
right. So,
Is that
ma'am, is definitely a topic which is the mode where we interact with everybody, and we should be very careful when we are expressing any emotion of ours. That has to be at least with lot of respect, ma'am. I'm
yeah?
sure, ma'am, this is a uh, age related topic, and every age, every kind of challenges may come, and I'm sure as a parent, we need to show a lot of positivity, try to be a good buddy to the children. That's what I'm, if I have make a the entire presentation of your, we need to bring lot of empathy, lot of conscious effort to be a good buddy to the child when they are at early age of life. We are the life coach for them as well. Now,
And
there's
one question about some
one more
nutrition.
question. Yes.
Nutrition. So nutrition, well, nutrition, yeah, I mean, nutrition will have effect on everything, the child's growth and development, the brain development. It is even seen that even iron deficiency can give rise to inattention. B complex deficiency is very important, B complex for the child. So yes, nutrition, good amount of protein, balanced diet, all those things are extremely important. I just thought that maybe before, we leave,
Hmm.
can this presentation be seen again?
Sure, 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 ma'am. You can
I
share
just
it.
want to see one few red flags. I mean, I had a presentation, speech and language and all that, but never mind all that. We
Sure.
will go to what is known as red flags for parents, because they should know, because parents are attending this, they should know red flags for language. So these few things are important because, okay, I'll just take 2 3 slides. I'm going to show what is important for the parents.
Sure.
So when you talk of communication disorder, there could be speech disorder and language disorders. Speech disorder may be articulation disorder because it's a part of communication, and that's what I'm saying. Fluency disorder and voice disorder, whereas language disorder could be the form of the way child speaks, that is phonology, morphology, syntax, content, that is semantic, and use, that is pragmatic of the child. Anything can be affected, and if anything is affected and it doesn't get corrected, then the child is going to live with it for a longer time. It's going to affect his self-esteem, and like emotionally it can affect him if you leave it uncorrected. So now just one more slide I want to show is that, so these are the disorders which you should identify early, or more than identify, say for example, if your child has articulation disorder, when the child says the and the law for it is acceptable up to certain age, but after that it is not acceptable. So there has to be also an acceptance saying that okay, my child is not speaking normally, he has an articulation or lisping disorder, and therefore I will immediately take an opinion and I will take therapy if required, because 5 to 6 months of therapy will correct many of the disorder. So another point that I want to tell you all is, so typically, when a child has speech delay, someone asks this question. So
Yeah.
if the child comes with the definite, see, there were some slide which says that what the child should speak at 1 year and what the child, but it's okay. We do this assessment of the child. So what he speaks at by 1 year, what he speaks at 2 years, what he should speak at 3 years, etc., etc. So there are marked conventions about what the child should speak at what age. But if the child does not speak appropriately, for you all the best way of knowing is okay, his peer group is speaking, his peer group is like that in this class or whatever online class, they are doing this, he's not doing okay, then there is a cause of concern. So typically the basic, absolute basic evaluation would be any child who has any speech issue will be a hearing test, because sometimes it can be hidden, the hearing, the lack of loss of hearing in the lower frequency. Psychological evaluation for the IQ, or we call it DQ for early age, and screening for autism spectrum disorder, because autism spectrum is a very wide spectrum disorder. So mild autism may show just few traits and along with speech and language delay, or sometimes they have what is known as a sing song speech, or sometimes the parents come and tell us सब आता है मैम, सब बोलता है टीवी में का पूरा नर्सरी राइम बोलता है, but there is no communication. He repeats the nursery rhyme, but it's meaningless. He doesn't do meaningful. So all those things should be known by the parents. And speech and language evaluation, a proper evaluation by speech therapist for receptive as well as expressive language. So this is a basic screening need to do when parent has any, anything, their antenna is up thinking that, oh, my child is not speaking properly, that his language is not developed, this is not proper, his pronunciations are not proper. You must get go to some pediatrician, developmental pediatrician, and do these things which are needful. Yeah, that's it. Thank you. I'm sorry, I just exceeded my
No,
time.
ma'am. These are quite a lot of information for many. Even there was a request from Mr. Mohammed who was looking forward for this.
Okay.
Since, ma'am, you have raised the topic of autism, as we discussed some time back, we have just conducted a beautiful art exhibition for the awareness of early. The biggest contribution, if we can do in the spectrum, is early identification.
Correct.
Let's see if we can take still build
In
a good.
all the developmental disorder, early identification and aggressive intervention is the most important thing you can do. So denial, you may, because of lack of knowledge, if you don't do it, it's okay. But lack of acceptance, one should not, um, intervene. One should not stop. I mean, not do the necessary intervention, because that period is so good that you can actually correct a lot of things.
This is what is going to be benefited for many. And I have already posted the link so that the attendees can also go through the beautiful art created for the promotion of this effort, early identification of autism. Spread it and spend some good time on the site. And thank you so much, ma'am, for your valuable time today. It was wonderful having to you today. And thank you so much, attendees, for spending your valuable time as well. Thank
Thank
you,
you.
ma'am.
Okay. I'll
Thank
be
you.
leading the meeting. Okay.